the health unit resides on land covered by the Robinson-Huron Treaty of 1850 and that we are all treaty people. This land is the traditional territory of the Anishinaabe people and is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. I encourage everyone to think about how they may contribute to the process of reconciliation.
Thank you, Mr. Shepherd. Before we go into the first item, I'd just like to make sure, I don't remember if last time or not, that we acknowledged that Dr. Zimbalati was approved by the province. And I believe, I can't remember, Mary Ann just asked me, and I couldn't remember if we had a meeting since. So anyway, we're here to acknowledge, making sure that everybody knows that you've been approved by, which we knew you would, but congratulations, and you're our medical officer. So thank you. So meeting to call to order. I need approval for the agenda, please. I need a mover and a seconder. Moved by Mary Ann. Second by Catherine. Go to vote. Rick Champagne, yes. Karen Cook.
Yes.
Claire Flowers, I believe he's not on yet. Sarah Inch.
Yes.
Jamie Lowry. Lowry.
Yes.
Oh, it's coming. Jamie McGarvey. He's not in yet. Jamie Restool.
Yes.
Marianne Sticklin.
Yes.
Morris Switzer is not with us. Dave Wolf.
Yeah.
Tim Shepherd.
Yes.
Catherine Still.
Yes.
Carried. Next on the agenda, conflict of interest. If somebody has something, they can bring it up at that time, or if you got something now, let us know. If not, just let me know. Thank you. Approval of the previous minutes. We need a mover and a seconder. Moved by Karen. Second by
It's Jamie here. I can move for Jamie Restool.
Jamie. Okay.
Yes.
We always forget about you on the screen. Recorded vote, Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Jamie Lowry.
Yes.
Jamie McGarvey's not with us. Jamie Restool.
Yes.
Marion Sticklin.
Yes.
David Wolf.
The question, actually, if I may, Chair.
Sure.
Resolution 2023-0905, moved by Sticklin, seconded by Restool. There seems to be no vote shown underneath that motion. I'm just wondering, was that vote held? I'm assuming it was, but there's no.
It's not shown on there? Okay, can you make a note of that and make sure?
2023-0905. All the other ones have the recorded vote showing.
She'll check it and we'll get back right to it, but it should have been done, so hopefully.
Yeah.
Okay.
Okay.
And so noted?
So yes, with the amendment, if it needs to be amended.
Okay, thank you very much.
Thank you.
Thanks, Dave. All in favor then? Thank you. Next item is 5.0, date of the next meeting. Am I missing something here? Because the sheet aren't cooperating here.
There were two.
Oh, there it is. Okay, 4.2. I didn't see it at the top. Thank you. 4.2, the Board of Health and Camera minutes from September 27th, 2023. I need a mover and a seconder. Catherine?
I'll do it.
Jamie? Recorded vote, Rick Champagne, yes. Karen Cook?
Yes.
Sarah Inch?
Yes.
Jamie Lowry?
Yes.
Jamie Restool?
Yes.
Marianne Sticklin?
Yes.
Dave Wolf?
I was absent, so I'll abstain from the
Abstain,
in-camera
okay.
minutes, please.
Tim Shepherd?
Yes.
Catherine Still?
Yes.
Carried. Next item on the agenda is date of the next meeting. which is slated for November 29th, which is next Wednesday. Time we determined, but I believe it's 5:30, I think the time, eh?
So there'll be finance and property at 5, and then the Board of Health at 5:30.
Okay.
Yeah.
There's no, motion for that, right? Okay. Business arising, 6.1, intimate partner violence and recommendations for local public health action. I'm sure we're gonna have some discussion on it, but I'll get a mover and a seconder, please. Sarah Inch. Jamie, Larry. J-Lo. I have a hard time. I apologize. I don't know what it is, but. Okay, any discussion on the motion?
I'll just hand it over to Louise, if I may, Chair, to,
If anybody has
speak to it.
questions, we can return. Okay,
Thank you.
thank you, Louise.
So Health Unit is presenting this motion to the board for their support in continuing and furthering our local public health unit's action in preventing and reducing intimate partner violence within the districts of Nipissing and Parry Sound. Intimate partner violence, which can include physical, sexual, and/or emotional harm toward a current or former intimate partner, is a serious, preventable problem that significantly impacts victims and their children, with effects across the lifespan. On an individual level, exposure to intimate partner violence has been associated with negative impacts to social functioning, mental health, and physical health. In addition, it has been well established through research that children exposed to violence in the family, either directly or through witnessing interparental violence, are at increased risk of intimate partner violence experiences in adolescence and adulthood. It is recognized as an adverse childhood experience. Adverse childhood experiences, otherwise known as ACEs, is a term used to describe negative, stressful, traumatizing events that occur before the age of 18. They are associated with risk of serious physical, mental health, and neurobiological problems, and more exposure to adverse events predicts greater risk in later years. Responding to and preventing IPV requires urgent and sustained evidence-based interventions by multi-sectoral agencies at a local and provincial level. It also requires a better understanding of the prevalence of the issue. While data on domestic-related police calls, emergency room visits, and deaths for partner violence have been reported locally for the Nipissing District, it likely does not represent the full extent of intimate partner violence. Research indicates IPV is generally underreported, and the risk and nature of abuse varies across age groups and specific populations, such as 2S LGBTQ+ and Indigenous populations. The Health Unit currently does not have access to local data that effectively measures the prevalence of the issue across the Health Unit district or for these specific population groups. Within its mandate, the Health Unit has an important role with respect to surveillance and primary prevention. To create communities free from IPV, there is a need to invest in surveillance and interventions that are effective in preventing violence or effective in changing risk and increasing protective factors. Research indicates that IPV starts early in the lifespan, in adolescents and young adults, highlighting the need for early prevention efforts and interventions targeting this population. The Health Unit has been engaged in addressing IPV both directly through individual client services and professional development, as well as indirectly through community development. We will continue to be engaged in youth and adult initiatives that promote an increased understanding of healthy and unhealthy relationships and increase awareness of available services and support. In addition, the Health Unit is a partner and co-chair on the Muskoka-Nipissing Parry Sound Children and Youth Planning Table. Priorities being facilitated by the health unit include positive parenting, adverse childhood experiences, and prevention of youth substance use. All of these contribute to the goal of building resilient children and youth and enhancing protective factors against a myriad of physical and social harms, including intimate partner violence. This work involves support from surveillance efforts, enhancing collaboration, and access to informed intimate partner violence prevention initiatives that will help build resilience and mitigate the impacts of IPV on children and youth.
Thank you. I don't know if I should read the motion first, or should we have a discussion? I'm not sure what the protocol is. Pardon me?
Discussion first.
Discussion, okay. So if anybody has any, just put up your hand and, go ahead, Dave.
So what is the value added that we bring to this conversation in the community? You talk about surveillance and prevention. What are the things we will be doing specifically in terms of those areas?
So, as I mentioned in the briefing note, we need to be advocating more at a provincial and regional level in terms of surveillance. So we don't have a true understanding of what the prevalence is of IPV in our community. And so there are ways to go about that in terms of enhancing our surveillance initiatives. So, for example, in the motion, we talk about advocating for using tools similar to what Statistics Canada does at a national level, and applying those tools at a more local level so that we can really understand what the impact is to our community and who the populations are that are most impacted. And that then can inform the type of interventions that we would implement. From a public health perspective, we play a critical role in terms of that surveillance, and so we would be partnering with agencies at the provincial level and even the national level to be able to bring that sort of surveillance here at the local level. In addition, we have a skill set in terms of looking at evidence-based interventions and effective public health practice. And so in doing that, we would be looking at the research and also evaluating interventions that are specifically targeting certain populations. So in the briefing note, we talked about youth, for example, and adolescents. There are effective strategies that have been used elsewhere that have been put in place to help reduce individuals from either becoming a victim or a perpetrator. And so they are strategies that we could look at, further implementing within our community and evaluating. Also, we are doing work with our partners relating to adverse childhood experiences. And that is about really working with parents and young children in terms of building their resilience. So it doesn't necessarily have to be that you've had a negative experience and that you are going to then have a negative outcome later in life. If we work on protective factors that build skills and resilience from an early age, as well as positive parenting skills, we can build those protective factors, which then prevent situations like this from occurring in the future.
So,
Yeah.
And I appreciate that. I'm curious what the tools are that as a Board of Health we use from a surveillance perspective. How do we acquire the information? Are we surveying the community? I see we're working in partnership with other agencies, stakeholders, and so forth. What I'm trying to determine is, from my perspective in this chair, what is the impact to the Board of Health in terms of resources, and what kind of tools are we employing to do the job that we're saying we're doing in the motion? Do you follow that? Does that make sense? I don't know if that makes sense.
Yeah, I think it makes sense. I think the role of public health, though, when we're dealing with a complex social issue, is one of a collaborator, and we have a piece in the puzzle. So we are on these tables, we are helping provide data or data analysis to various tables. For instance, the Violence Against Women Coordinating Committee, we helped provide some of the data that they based their actions on.
And I'm familiar with that table. And part of the reason I asked the question is, we used to sit at that table, did we not?
And we still do.
Do we still have a voice at that table?
Yes.
Okay.
Yeah.
My understanding was different, but I just wanted to verify that. So I wanted to make sure that what we're purporting to be doing in the motion are things that we're actually doing in the community. And that significantly difficult issue impact is tremendous on the community. And I just want to be sure that we're not just paying lip service because we feel we should be doing something, that we are actually doing something. That's why I asked about the tools we're using and the kind of resources that we're employing. So I'm not trying to be combative or argumentative. For my own purpose, I just want to get my head around what that looks like for us.
Yeah, so I would say very much so. In terms of work we're doing independently, we are training frontline staff to be in evidence-based tools to be able to promote disclosures, so that we can then facilitate referrals and that sort of thing. But in our main roles, in terms of the surveillance and primary prevention, it's very much our role as a collaborator, I think, because none of those big issues are going to be, you're not going to move the needle on them as an individual organization.
Right, and although there are social determinants and health outcomes as a result of this, it's not sort of our strictly speaking, maybe our lane, so to say, right?
I mean, definitely in terms of the public health standards, we do have a role in injury prevention and, mitigating violence, preventing violence is certainly a part of that, but it is a collaborative role.
Okay, no, thank you. I just wanted to get some clarity for my own purposes. I appreciate the answer.
Yeah, and I'll just add to that too, within our Healthy Growth and Development Standard, it very much talks about ensuring that our babies and children grow up to be resilient. We work with parents before they become parents, and then new parents in terms of creating that supportive environment, which is all critical, right, to where we end up as in terms of being adolescents and adults. And so that is one of our primary mandates within sort of our Healthy Families program. And also within our sexual health program, we also working closely with youth in schools and around healthy relationships and being able to identify characteristics that are either unhealthy and or healthy, and how to go about addressing those.
Yeah, and the language we sometimes use is sort of rigid as opposed to broader in the community. And I think what you just said is a little more impactful because it speaks to what we're actually doing and what we can do from a hands-on perspective. Collaboration is, what does it mean? I mean, we're all collaborating in one way or another to try to find positive outcomes. So thank you, because that was extremely helpful. I appreciate it.
Again, saying that in layman's term, my point of view again, we've been doing this as part of our program for a while. It's just we had an issue with some of the wording, right. And this is what this is all about. Okay. So we don't have one violent crime is too much, obviously. We just want to make sure that from the health unit standpoint is that we're creating something that's from the health unit, not from another source, and what we do. And what, like you said, Dave, is what's our role in this? This is what our role is, and we'll read that in the motion, and hopefully at the end we'll come up with an understanding for the health unit to the public.
Thank you.
If I may add, there's also a Violence Against Women Coordinating Committee for Parry Sound as well, and so we have membership also on that committee. So just to make sure that we do represent both Nipissing and Parry Sound District.
Right, and I noticed that in the motion, and it's important because I think in some of the smaller communities that are underrepresented at some of these tables, we might be the lead or the contact for in some ways. So thank you again.
Does anybody else have a comment before I read the motion? Sarah?
Sure. So, yeah, I think it's a great motion. There's lots there, and I think it certainly isn't simply virtue signaling. I think that it's unfortunate that intimate partner violence is only discovered after the fact, but that the health unit does have a special role here through its many collaborations with so many groups, and also through its increased contact with the community. So someone might come in and the health unit might be able to step in and intervene. And I think that it's great that we can do that preventative piece. And also, like you said, build resiliency for our youth and for future generations. So thank you very much for your hard work on this. It's great.
Thanks,
Jamie?
Look, and in the motion, I just noticed that Merle Fulton is being copied. I don't know whether she's the, I think she resigned some time ago.
Okay, so that's the, sorry, I don't have the.
I haven't read it yet,
Minister
but-
of Children.
Yeah, I don't think she's,
We
we just have to make sure
amend
it's the
that.
right.
Okay,
right
thank you very
minister.
much. I think just one other thing I wanted to highlight with this motion is that, understandably, there's a large focus on, victims of intimate partner violence. But I'm hoping that through what I spoke to earlier, that we can also see the equal impact, and potential future impact of having, children involved in these situations. And from a preventative perspective, it's really critical that we are thinking about them in this lens in terms of preventing future intimate partner violence.
Okay. Go ahead, Dave.
Further to Mr. Lowry's point, I wanted to ask, does the motion get shared with our member municipalities as well? Is that a matter of, I don't know if they get our minutes, I don't know if they get our motions, and,
Well, they get a copy of our minutes.
okay.
Yeah.
So they'll have the motion.
Yeah.
Thank you very much. I wasn't aware of that.
Yeah. Any other questions or comments? All right, I'll go on to read the motion. Moved by Sarah Inch, second by Jamie Larry. Whereas the Ontario Public Health Standard identifies violence as a topic for consideration within the substance use of injury prevention standard and requires public health units to use a comprehensive health and promotion approach that addresses risk and protective factors to reduce the burden of preventable injuries in the health population. Whereas the Ontario Public Health Standard requires public health units to monitor and assess trends related to the injuries. Whereas public health units and their programs such as Healthy Babies, Sexual Health, respond to disclosure of intimate partner violence or support disclosing of intimate partner violence within the individual client care using the best practices. Whereas it is well documented that intimate partner violence is a serious preventable problem that significantly impacts victims and their children with effects across the lifespan and has considerable societal costs associated with medical and mental health services, lost productivity, and criminal justice and child welfare costs. Whereas responding to the preventing intimate partners violence, it requires urgent and sustained evidence-based intervention by multi-sectoral agencies at the local and provincial levels that are effective in preventing violence and effective in changing risk and increasing protective factors, especially in adolescents and young adults. Whereas intimate partner violence is generally underreported, locally reported police, victim, and healthcare services data likely does not represent the full extent of the intimate partner violence, nor the risk and the nature of the abuse and how it varies across specific population groups. For instance, 2S, LGBTQ, and indigenous. Oh my God. And age groups. Local level survey data is not available on intimate partner violence as collected through the Statistics Canada General Society, Social Survey, and Canadian Safety, victimizing, or observed childhood experience. I'm gonna take a drink here.
It's a long one.
So therefore, be resolved that the Board of Health of the North Bay Parry Sound Health Unit is committed to being a member of Violence Against Women Coordinating Committee, VAWCC, of Nipissing provincial experts and community partners to enhance surveillance, methodology, knowledge of effective preventive strategies, promote the local service, and capacity for collective action and evaluation. And further, be it resolved that the Board of Health call on the Province of Ontario to invest in surveillance and analytical methodology at the provincial and local public health units level to gain better understanding of the preventives of the intimate partner's violence and adverse childhood experience, and the permit of monitoring of trends and data-informed action. And furthermore, be resolved that the Board of Health call on the Province of Ontario to develop a provincial intimate partner violence strategy to support the identification, implementation, evaluation, and the monitoring of the effective violence prevention strategies. And furthermore, it be resolved that the Board of Health call on the Province of Ontario and the Ministry of Children, Community and Social Services to increase the funding allocated to the Healthy Babies, Healthy Children Home Visiting Program that is to operate out of a local public health units. The program directly services individuals' parents who need more support. Within this work, staff respond to disclose of intimate partner violence and support disclosing of intimate partner violence. The annual budget for the Healthy Babies, Healthy Children program has not increased in the last 10 years. Furthermore, be resolved that the Board of Health provide correspondence of these resolutions to the district municipalities, Ontario Boards of Health, Vic Fideli MP, Graydon Smith MP, John Vardoff MP to Miskaming, the Honourable Doug Ford, the Honourable Marilyn Fullerton, Sylvie Jones, the Honourable Michael Kesner, José Bégin, Assistant Chief Strategic and Stats Canada, and the Chair of the VAN, which is Nipissing and the ANC of Parry Sound. Okay.
Good job. Thankfully, it was short.
Yeah. It's long-winded, but it's necessary. It's the way it's dedicated for the health unit. It's made by the health unit. It's not by an outsource. It's what we do, and it's what we represent. So I'm going to ask for a recorded vote, please. Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Jamie Larry.
Yes.
Jamie Restool.
Yes.
Mary Stickland.
Yes.
Dave Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still.
Yes.
Jamie McGarvey, are you here?
Yep, I'm here. Yes.
Okay, sorry. You vote for?
Yep.
Okay, thank you, Jamie. So it's carried. Thank you very much for your time and effort you put into this, Louise, and it's very in-depth. Thank you, and Dr. Zimbalati. Where's my stuff going now? Okay, report of the medical officer of health, 7.0.
Yeah, so it is in the package. However, things are rapidly changing in the world of respiratory viruses, changes by the day. So thought I could give just a brief update, again, according to Public Health Ontario's most recent stats, as well as our local. So in terms of Public Health Ontario's predictions for the next week or so, they do see COVID, RSV, so respiratory syncytial virus, and influenza all increasing in over the next week. Locally, we have seen an increase as well, especially in influenza, with 12 cases reported so far as of the end of the last reporting week, and 6 of those cases happening in the last reporting week. So it is escalating, and we have had the first outbreak in a highest risk setting in the last reporting week as well. So we will be declaring that there's local activity instead of just sporadic activity, probably as early as tomorrow. And we'll be sending out some messaging for the public in terms of the layers of protection that we recommend to protect themselves, especially over the upcoming holiday season, as well as sending a bulletin to healthcare providers. Apart from that, you'll see that there's some updates on the strategic plan, which is, I think, one of our key areas of focus for the health unit, and that the planning is ramping up, so we're very excited to see that in progress.
Well, thank you, Dr. Zimbalati. Any questions for Dr. Zimbalati?
Sure.
Sarah?
Is there a mask mandate going into place?
So what we do instead of mask mandates, and really at the general population level, we're not planning on implementing. There would have to be something very severe and unexpected for us to even consider that option. We're trying to use much finer tools rather than that very blunt tool to move the needle and protect the populations that need the most protection. So in certain specific settings, so for example, long-term care, the Ministry of Long-Term Care has required masking in those settings, and the Ministry of Seniors and Accessibility has provided recommendations, strong recommendations for retirement homes, for example. What we do is we provide the indicators, especially on our dashboard, but also through communications with organizations such as hospitals and long-term care and retirement homes and other types of high-risk settings, so that they can make their decisions about what measures they need to implement in terms of, distancing or occupational health and safety policies, masking, any visitor restrictions, that sort of thing, because it is very much an operational decision based on the population that they serve as to what is the most appropriate course of action. So we do support those decisions through our dashboard, as I said, as well as the Infection Prevention and Control Hub, which is hosted through the Health Unit and our Communicable Disease Control Program.
Okay, I have Dave, then Tim.
Oh, thanks. First of all, you mentioned the dashboard. I just wanted to say it looks great.
Oh, thank you.
Yeah, so kudos to the staff that put that together, because it's easily found, easy to navigate, and all the information pops right away. So, very well done. With respect to, I've got a couple of questions. With respect to the strategic plan, are all the meetings taking place virtually? Are there in-person sessions? And is there some board inclusion in that? That may have been mentioned at another meeting, and if it was, I apologize, but if you could indulge me a little bit.
Certainly, the Board of Health is one of the groups that will be consulted on the plan. In terms of, we're trying to balance, of course, timeliness and cost with the need to gather fulsome feedback and perspective. So we have a strategic plan advisory committee who is interacting with the the organization who is conducting the strategic plan for us.
Platinum Leadership?
Platinum Leadership, yes. And so they were finalizing the engagement strategy, and
Are we
certainly
sort of
with
in the infancy
staff-
right now?
Hmm?
We're sort of in the infancy right now? Like we just started essentially?
Exactly.
Okay.
Yeah. So in terms of community engagement, I'm not sure that there are in-person sessions planned with staff. There will be some in-person. Louise, are you aware of Board of Health, whether there's plans for that to be in person or not? I thought it was management executive team, but recognizing that everyone is coming from different locations, I think that will be virtual.
And Platinum Leadership is from London, so what I was trying to get at is how much travel and so forth, what are we, I don't want to, the important work of the coming to a usable
Yes.
strategic plan, one that actually is a living document, right? Let's not spend a lot of money on travel and accommodations and all that
Yeah.
other stuff.
We do have one member of Platinum Leadership visiting here between December 11th and 13th.
Okay.
To do the some of that in-person work, but the rest of it will be done virtually.
So just for my own, because this is my first time on the Board of Health, sitting at this table, but other boards that I sit on, the strategic plan sort of is the ownership of the board. It belongs to the board. It sets the guidance and the tone for the coming years or two. So I just wanted to verify that all of the individuals at this table will in some way have some participation. I'm not suggesting what it should be. I just wanted to verify that.
Yes, certainly,
Okay.
certainly.
Thank you. I've got a couple of questions, if you don't mind. I'm going to try to be as delicate as I can. The issue in Powassan, I only know what I have read in the media. And I just want to know, are the media accounts of what was found to be accurate? Do you understand what I'm asking?
Yes, I would say that is the case. We have since conducted a re-inspection on Monday, and all of the items of concern on our closure order have been addressed.
So they're now compliant?
We have rescinded that
Okay,
order,
perfect.
and then the rest is up to CMHA
Okay.
to decide the future.
Yeah, I only seen the media accounts, so I just wanted to verify. We also have under professional practices for the fall semester, the health unit is supporting 21 students from various disciplines such as nursing, dietetics, and social work across several of our programs and services. I'm wondering where those students come from. Are those Canadore and Nipissing students, or are they from other communities?
I believe they're primarily Canadore and Nipissing, yes.
And I wasn't clear to me, maybe it's clear to others, and I apologize if it was. Do we accommodate them here at the health unit, or do we accommodate them in the community? Like, is this a partnership that we engage in some way, or are we actually providing opportunities for the 21 individuals?
We are providing opportunities.
Excellent, that's great, thank you very much. There was, I had the notes, and I apologize.
If you want to, Dave, I can go to Tim, and if you want to take a look at it, or.
No, I think there's only two more actually that I'm actually interested in, Chair, if you don't
Yeah.
mind. The food inspections comment in your report I found interesting. I'm wondering if we also have, and if we do, I didn't see it on the website. Do we have a dashboard for that so that citizens of the community can see at a glance what this
Yes.
looks like, who has been tagged, for lack of a better term, I apologize if it's not the proper term, but who has been tagged, whether they've been yellow flagged, red flagged, or whatever those are, and what the outcomes are so that local businesses have an opportunity to become compliant, and then it's shown on the dashboard, if we have such a thing, that they are compliant.
So I wouldn't say it's a dashboard, but we have Check Then Go on our website.
Okay.
So you can enter in the name of the business that you're interested in and see the compliance reports and the current rating. And if there were infractions, like when the inspections happened, all of those sort of details.
Perfect. So when a local establishment has had an infraction, are they required to post?
Yes, so we provide a notice
Yeah.
that, like a color-coded notice that they are required to display. They're required to display if it's a pass or provisional or not.
And do we go back to verify that they are displaying?
We do.
And what happens if they are not displaying?
They are found not in compliance and there's a potential for fines.
So can you, maybe there are multiple fines. What are the fines? How does that work? I'm just curious to know how this operates.
In terms of the monetary value, I would have to get back to you on that. You know, usually it's a couple of $100s, but I'm sure I don't have the information on the gradation of the fine, but I can provide that.
And my final question, and perhaps we're going to get to it, at the beginning of your report, under strengthening public health, which I find this whole process fascinating, it says that you will be seeking further guidance from the Board of Health on November 22nd, that being today's date. Are we having a more fulsome discussion about that this evening?
Yeah, so we'll have an in-camera session.
Thank you.
On that today.
Thank you.
Okay, Tim?
Just a quick question, Doctor. I'm through the rumor mill, and maybe you can address it, but I'm hearing from seniors and other people that they're saying there's a shortage of COVID vaccine and the flu vaccine as far as getting it out to the various drugstores, and is that true, or?
So there isn't a shortage. In terms of the high dose vaccine, which is the preferred one for highest risk, so the 65 plus, there's only so much of that the province procures, and the province has no more of that stock. But there is ample other flu vaccine. You've probably been hearing about distribution issues to pharmacies. That is now done by a private company, which is under the umbrella of Shoppers Drug Mart. And there have been some issues flagged. And in fact, McKesson does supply to health units as well. And we've had some struggles as well. But it's more, as long as you're on top of it, you can, from a health unit perspective, you can get the vaccine in time. You can't wait last minute to order, certainly. But we do have ample supply here. And in a pinch, we will supply to a pharmacy. So yeah, locally, it's more just that high-risk vaccine, the high-dose influenza vaccine is...
Okay. Well, that's good to hear. Like I said, I've been hearing that and just wanted to clarify if it was indeed true or not. So, okay, thank you.
I have a question for you, Chair.
Sure.
Are we going to be discussing the staffing portion of Dr. Zimbalati's report while we're in camera?
I'm not exactly sure which one you're talking about.
Oh, if it would have to go into camera if we're discussing an identifiable person.
So if I have a general question about the nature of your report, I prefer just to maybe leave it and I can ask my question in camera just to be safe.
Okay.
We can add it, we'll have to add it before, but we can add it into it for sure.
Thank you.
Okay.
It's not, by the way, it's not a hard question.
Okay.
No, and great questions and great comments. Does anybody else have any? I keep forgetting about Jamie Restool and Jamie McGarvey online there. You could, the Jamie Show. Have you guys have any comments? You're good? You're good? Perfect. Thank you. All right. So we'll move on unless you have comments. Thank you, Dr. Zimbalati, to answer all the questions. And Louise, thank you so much. Next one is Board of Reports. I don't think there is any at this time. And correspondence, if there's anything you want to look at, it's in your packages, right? Mm-hmm. Yeah, I just realized that, but I just don't think anybody has any questions, that's all. So we'll move on to new business, 10.1. This is endorsement of the Ontario Public Health Association letter monitoring alcohol marketplace and product sales. I need a mover and a seconder. You want some discussion? Mover? Oh, I see Jamie McGarvey over there. And seconder?
Jamie Restool.
I don't want to, Jamie Restool? Perfect. Jamie Restool. We got two Jamies.
Or three.
That's J-Lo. Okay, discussion on the motion before I read the motion. Dave?
If I may, where it refers to, therefore be it resolved that the Board of Health endorse the letter from the Ontario Public Health Association on modernizing alcohol marketplace and product sales to raise awareness about and to work to reduce the impact of increase. I couldn't access the letter. I know, the link didn't work for me. So I couldn't access the letter, so.
Oh. Okay. It worked for me here just now, but
Okay.
maybe, yeah.
Okay, thank you.
Any other questions, comments?
I can just give a little preamble.
Sure.
If that helps, and it will be shorter than the last one I gave. So the Health Unit is presenting this motion to the Board for their support in advocating for provincial policy measures to reduce the impact of increased access to alcohol. In 2019, the government made several regulatory changes that led to the relaxation of alcohol control policies in Ontario. As a health unit, we're particularly concerned about the alcohol policy in Ontario as our population has significantly higher rates of emergency department visits and hospitalizations due to alcohol consumption compared to the overall Ontario population. In 2020, approximately 26% of health unit district residents reported being heavy drinkers, with 21% consuming 7 or more standard drinks within the last 7 days. Increased availability and affordability of alcohol has a particularly negative impact on school-aged Ontarians, for whom the risk of adverse outcomes from drinking is greater than adults. Alcohol is the most commonly used psychoactive substance amongst youth and young adults. It is the leading risk factor for worsening academic performance, injury, violence, suicide, and death. Canada's guidance on alcohol and health states that alcohol consumption should be delayed as long as possible for youth. As alcohol retail density increases, especially near schools, youth are more likely to adopt or maintain high-risk drinking behaviors. This is of specific concern in our health unit district, given that 86.7% of high schools and 62.5% of post-secondary institutions are within 3 kilometers of at least one of the 64 alcohol retailers in our district. In addition to the short-term impacts of alcohol, it is also a well-established risk factor for death, disease, including certain cancers, cardiovascular disease, and liver disease, as well as disability, unintentional injuries, risky behavior, social problems, and violence or aggressive behavior.
Thank you, Louise. Do you have any questions before I read the motion? Thank you for the report. So moved by Jamie McGarvey and second by Jamie Restool. Whereas alcohol is a well-established risk factor for death, disease, including certain cancers, cardiovascular disease, liver disease, disability, unintentional injury, risk behavior, social problems, and violence of aggressive behavior. Whereas the health unit district has significantly higher rates of emergency department visits and hospitalizations due to solely to alcohol consumption compared to Ontario. Whereas the health unit district has significantly higher rates of heavy drinking episodes for persons aged 19 years or older compared to the Ontario. Whereas increased availability and affordability of alcohol has been particular negative impact on school-age Ontarians for whom the risk adverse outcomes from drinking are greater than adults. Alcohol is a leading risk factor for worsening academic performance, injury, violence, and suicide, and death to our youth. Whereas within the health unit district, the majority of high schools, 87%, are almost 2/3 of the post-secondary institution, 63%, are within 3-kilometer distance of an alcohol retailer. Whereas when alcohol becomes more available and affordable, there's an associated increase in health care cost, lost productivity, criminal justice, and other direct costs. Whereas the 2019 regular changes that have led to the relaxation of alcohol control policies have already placed Ontarians at an increased risk of harms, health, and related outcomes. Therefore, it is be resolved that the Board of Health endorse the letter from the Ontario Public Health Association and Monitoring Alcohol Marketplace and Product Sales to raise awareness about work to reduce the impact on increased access to alcohol. And furthermore, be resolved that the Board of Health call the Ontario Province of Ontario to implement the following policies and measure. Reduce retail density. Maintain and decrease hours of sale with no exceptions. Strengthen Ontario alcohol pricing policies, including taxation, minimum pricing, or other means. Stop further privatizing of alcohol sales. Apply the whole of government health all-in policies approach to alcohol and modernization, and furthermore be resolved that the Board of Health provide correspondence of these resolutions to the district municipalities, other boards of health, Vic Fideli, Graydon Smith, John Van Thoth, the Honorable Doug Ford, the Honorable Sylvie Jones, and the Association of Local Public Health Agencies, ALPHA. Any other discussions or long ones tonight? So we'll have a recorded vote. Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Jamie Larry.
Yes.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Mary Ann Sticklin.
Yes.
David Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still.
Yes.
Carried. Next item, we're going to go into camera. We need a mover and a seconder to go in camera. Mary Ann Sticklin. Jamie. J-Lo. I'm sorry, Jamie, I just can't seem to get
Oh, I've been called worse.
Jamie Larry. All right, Rick Champagne, yes. Karen Cook.
Yes.
Sarah Inch.
Yes.
Jamie. J-Lo.
Yep.
Jamie McGarvey.
Yes.
Jeremy Restool.
Yes.
Mary Ann Sticklin.
Yes.
David Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still.
Yes.
Carried. We're now going into camera. adjournment. Thank you very much, everybody, for coming out tonight, and great discussions, great opportunities, and we'll keep the public informed of what we're doing, and we'll see everybody on the 29th for our budget meeting.
Times, 5?
5?
Yes. Thank you again. Thank you for coming out tonight, and have a great evening, whatever's left.
Good night, everybody.
Good night, Jamie. Jamie?